I'm Monica Fox. I'm the Director of Outreach and Government Relations for the National Kidney Foundation of Illinois. In 2013, I was suddenly diagnosed with end-stage renal disease.
The next phase of Monica's journey was kidney transplantation.
So when I went to get worked up for transplant, the first thing they said was that it's best for you to learn to share your story. You have to reach out and let people know that you're in need. Well, that was mind-blowing to me. I thought about my mother and my grandmother, and I thought, what will they say if I start telling people what's going on with me health-wise? You know, I learned I really had no choice. I had to talk about it. So I started first with friends and family.
More than 50% of patients awaiting kidney transplantation in the United States are ethnic minorities, with Black Americans constituting more than 32% of those on the waiting list for transplantation. Despite the substantial advancements in kidney transplantation, it has been extensively documented in recent decades that significant disparities still exist between Black and white Americans when it comes to access to kidney transplantation. The factors that contribute to reduced access are complex and include patient preferences, clinician biases, longer time on the transplant waiting list, poor availability to patient education, inadequate health insurance, and lower rates of deceased and living kidney donation.
I was volunteering for Gift of Hope, and they created a video about my story, about me waiting for transplant. And I shared that video all over social media. And people did come forward and get tested for me. And my daughter, she also came forward and got tested for me. She kept saying to me, "Mom, what if something happens to you and I could have saved you?" Couldn't imagine my daughter having to be my donor. And so she did. She started going through the process, and it was heart-wrenching for me to think of my daughter being my donor. But in the time that I thought she was able to be a donor, I became paralyzed with concern for her. But that was all because I wasn't as well versed about the process at the time. I know so much more now I've met so many living donors who live such long and healthy lives and feel so great because they have donated the extra kidney that they didn't need to save someone else's life. The more information you can receive about the process, the better your informed decisions about your care are. It seemed like a sign from God that she was not supposed to be my donor because every time she went to the transplant center, something went wrong. She would either arrive at the transplant center and the appointment wasn't scheduled. When they went to put her in the machine wouldn't work. And eventually I said to her, "Olivia, this is not what God has for us." Because when it's a part of God's plan, it's easy and it just happens.
Monica spent 3 years on dialysis before receiving the call she'd been waiting for.
And then I received a call on a Monday morning from a friend who had also come forward and wanted to be a living donor for me, but wasn't able to. And she shared with me a story about a family friend who had been in an accident in Tennessee, her friend's uncle, and they were preparing to donate his organs. And they wanted to know who was going to receive his liver and his kidneys, if possible. And she called and asked me if I was still waiting for a kidney. And I said, "Yes, I am." And she said, "Well, can I give them your name and number?" And she was able to connect us, and he was a suitable match for me. And that is the way I received my kidney donation in 3 years instead of waiting 5 to 7 years. But it was because I had shared my story all over social media that I received the gift of a directed deceased donation, in addition to having many, many living donors who came forward and either were willing to get tested for me or did get tested.
In addition to the positive health outcome for Monica, her journey with kidney disease has led her in finding her life's mission.
So this kidney journey has been absolutely life-changing. The day that I woke up from my kidney transplant surgery, I felt 200% better than I had in over 3 years. It was truly miraculous. And today, I feel very well. God put me on a mission here. So I worked my way into a job at the National Kidney Foundation of Illinois. So now, full-time, I'm able to advocate for people with kidney disease. I'm able to coach people from dialysis to transplant. I'm able to guide family and friends who receive a sudden diagnosis of chronic kidney disease and don't know what to do, aren't told that they can make some nutritional changes and slow the progression of it. I feel like I am just so fortunate. I feel like this is a difficult journey that I wouldn't want to see anyone go on, but it has changed my life for the better. It has changed my daughter's life for the better. She is now working for Gift of Hope, the organ procurement organization, educating people. I feel great. I feel blessed. I feel honored to be able to guide other people through this process, to educate and help them to hopefully have even better outcomes than I have experienced.
CKD may be treated. You can take actions that may prevent or stop the progression.
The first thing you want to do is get in touch with the dietitian. And at National Kidney Foundation of Illinois, we do have a dietitian that does complimentary consultations to help people to learn what they can do to slow the progression of kidney disease. The other thing is educate yourself about kidney disease. Learn as much as you can. Most people have a caretaker, a caregiver, a family member who is their advocate, who works together with them to help manage these things, because there really is a lot to it. It's important to have a partner, a care partner, who can help you understand, who can help you remember the many things that the nephrologist tells you during your visit, that the technicians remind you of as you leave dialysis. I explain to people, learn what your labs mean and follow up with all your appointments. Don't hide your head in the sand. It's not going to go away. You have to face it. If the doctor asks you to have labs drawn every 3 months, have labs drawn every 3 months. It's not going to go away, but you can slow the progression and you can live a healthy life even with CKD. My grandmother always used to say, faith without works is dead. The truth of the matter is, you have to do your part. You really have to participate because it is your treatment. So I made it my business to become a dialysis professional so that I knew what was best for me. Basically, during that period of time, for 3 years of my life, I called myself a professional patient. And my job became my health care so that I could be here for my daughter and now for my beautiful 4-month-old grandson. I'm Monica Fox. I'm the Director of Outreach and Government Relations for the National Kidney Foundation of Illinois, and I am a very grateful kidney transplant recipient, transplant coach, advocate, and patient ambassador. And this is my beautiful grandson, Jacoby Edward Brown, who's 4 months old.
Monica encourages everyone to take the Be Real pledge. Be aware of the stigma that may exist. Avoid the trap. Reject the notion that it is better to not know than to know. Early detection. Act with a sense of urgency to slow progression. Advocate for yourself and share your insights with loved ones. Line of vision. Work with your healthcare team to take control of your health. Be an active player in making treatment decisions.